Hello everyone and welcome to the Navin Times Talk from the Heart. Our guest today is Brian DeCosta, a musculoskeletal, orthopedic and a sports physiotherapist who has been practicing from the last 13 years. He has worked in hospital, clinic and sports setup and at present is working in the UK. Hello Brian and welcome to our show.
Thank you.
Brian, I said that you are at present working in the UK. You were before that in Goa. Can you tell us a little bit about what you have been doing all these years?
So I graduated in 2009, quite a long time ago. I worked in Mumbai after that for a couple of years. I'm basically born and raised in Mumbai, but I'm Goan on my father and mother's side.
Right.
Since I worked in Mumbai for 2 years, and then I moved to the UK. I studied in University of Nottingham. I did a sports and exercise medicine course. I always had a passion to be a sports physiotherapist right from my first day at college. So my path was very clear and cut out for me. After doing a year in the UK, I worked a little bit with British sport. But because of visa regulations, I came back to India. Now I came back and lived in Mumbai, and I was thinking I want to work in sports. I don't want to go into a clinic or a hospital setup. And that's when Goa presented itself. One of my first loves is football, and my intention was to move to Goa and look for a club that needed a physiotherapist. And Goa is blessed with having a number of football clubs at that time playing in the I League, which was the top tier of Indian football. So I had the opportunity of joining Sporting Club de Goa as their physiotherapist. And that's the job I took. Now, that was in 2013. I spent about 4 or 5 years, I would say, within the football circuit. I worked also with Mumbai City Football Club and FC Goa for a year. After that, I decided to practice on my own because at the time, football was just 4 months. And I thought maybe I should be doing something else the rest of the year. And that's what took me to kind of joining my cousin at her clinic in Panjim. It's called Elite Physio. And I joined her and I ran the clinic, alongside her while she was on maternity leave, and I was able to take over the clinic for a little bit. And from there, spent 5 years there. The idea of me not opening my own clinic was always because I had this calling to kind of work in the UK. I always felt after studying that I would have liked to work in the environment, which at that time I felt, and even now, so it always is pushing you really hard, and I like pressure. And that's the reason I came back here and, trying to grow my skill, grow my knowledge. And that's where I am right now.
Okay. Brian, you have spoken a lot about football. You said you have worked with the I League, FC Goa, but you also worked with, if I'm not mistaken, Sachin Tendulkar. Am I right?
Yes, that was at the beginning of my career. So it was very interesting. I joined a very elite sports physiotherapy clinic in Mumbai called Prakriti Sports Physiotherapy Clinic, the sports science and physiotherapy clinic. And I mean, my first patient I remember I think it was a Rajasthan Royals fast bowler who got injured during that current I League.
Right.
That was in 2009. So that kind of set the bar for me, I think, at that clinic. And I grew really well. I was a very hard worker at the clinic. I learned from my bosses. And I think one morning I got a phone call from the receptionist saying, my boss wants wanted me to accompany her to a patient, and they gave me the address and told me it was Sachin Tendulkar. So I was I was quite wowed by that. I couldn't believe it initially, but yeah, that was just, I think he was already a client with my other physiotherapy clinic that I was working at, and I just got the opportunity to work very closely with him. I think the plus on that side of the story was this was in 2009, and when he got injured in 2010, he asked the Indian team physio to personally call me, and so that I could see him again when he was in Mumbai. So I think that was a plus for me. Of
And
course,
that
I
was
got
another wow
my.
moment, I think. Brian, that would be
I
another
mean that.
wow moment, right?
I mean, yeah, I mean, at that time, I'm a loyal person. So I spoke to my boss and said, I've got this call. And she was not very happy initially, but then she realized that, I'm on her side. And, we both took care of the situation together.
I'm sure.
And it was good. I treated him another 10 sessions at his residence. Um, that's 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 my wow moment with Sachin Tendulkar at
Of
that time.
course. And that
It was in his 20th year as well.
and all these experiences add to your sum total of experiences that you have, and it is beneficial not just for you but for all your patients, I'm sure.
Yes, I mean, after you treat Sachin Tendulkar, I also, treated a few, you know, Bollywood people and as well as businessmen in the Mumbai circuit. You kind of build your own personality. So when you treat
True.
another sportsman, it's okay, been there, done that. You've
Right.
already treated the pinnacle of Indian sports. And so I think it builds your personality, it builds your confidence, builds the way you discuss cases, discuss options, and no one can really intimidate you.
Right. Right. So, Brian, today we see a lot many physiotherapists around than there used to be earlier. I think there are more people who are choosing and opting for physiotherapy as a career. Now, besides just injury or surgery, does physiotherapy therapy affect any other areas?
Um, so there are a number of avenues that physiotherapy can kind of affect. I think one is the typical one is, surgery, pre-surgery or post-surgery. You need therapy. The therapy is either preparing you for the surgery or recovering you from the surgery. Then you have the sports physiotherapy, where you are preparing the athlete for their sport or optimizing their performance, trying to get them to give the best that they can, not only physical, sometimes also mental. We do a kind of dual role at that. Um, but then there's the other aspect of physiotherapy for people with daily life problems, like maybe a lower back pain, or someone who's walking on the pavement, they sprain their ankle. So these common injuries that we see in our day-to-day clinics is what is really the bulk of the caseload that we take care of. And the interesting thing is most of these patients are first contact. That means they come to us first. They don't necessarily go for an ankle sprain to a doctor. Many of them do. But those who are aware of the benefits of physiotherapy, or the fact that you may not need a chemical agent going in your body to recover an ankle sprain, these are the people who choose to come to us. And I think that number is increasing. There is awareness increasing. Of course, we'll always have physiotherapists and number of physiotherapists coming out because of the number of courses and colleges. We do also have, I think, at a certain age, a number of physiotherapists that leave. I would say that leave the field. Statistics show that most of the physiotherapists, as a percentage of men and women, most of them are women. So I think at a certain age and family life, there might be a number of people leaving, but also you have we're lucky to have a number of new graduates coming out regularly. The only challenge with that is sometimes you are not able to give the full extent of experience therapy to patients. And that might be one of those, key points that could dissuade a person from going to physiotherapist if they feel that all the physios in a clinic are 21 years old. Maybe they don't have confidence in the age of their therapist, or the experience levels of their therapist. Of course, luckily in Goa we have a healthy mix. We have a lot of experienced physios who grow their practice by recruiting juniors, training them,
Right.
keeping them under their wings, and just promoting the field in general.
Right. Now, with more and more people living sedentary lives, is it true, in your opinion, that the problems with their backs and muscles and stuff like that are they on the increase? Are the conditions, the ailments, on the increase?
I mean, now that you use the word sedentary life, I think recently, especially in Goa, there's been a great revolution towards the opposite. I think people have been realizing, this word has been used till from the 90s. I think, sedentary, we're watching TV, then we are on the computer, then we are, couch potatoes. But now you see a lot of people, especially in Goa, because, we're talking about Goa primarily. We see a lot of them getting up, moving, I had a patient who picked up becoming a triathlete at the age of 60. He started learning how to swim at the age of 61 because he didn't know how to swim. So a lot of people are moving towards, being mobile and not leading the sedentary life. But if you are talking about, being in one position for too long, for example, in the recent situation of work from home, where you don't really have to get up, travel to your office and then sit there and then travel back and then maybe go out for a lunch break.
Yes.
You're in your
Right.
cocoon for maybe more than 8 hours a day because you're working from home. I think that presents its own set of problems. I wouldn't say that there was definitely an increase in low back pain. I remember having patients come and say, oh, they have a back pain, and then ask them how what their seating position is at work, and they are lying in bed working. So
Yes.
it's different for different people. But I think with your question, there's no real increase. It's always been there. It's constant. But I think the types of conditions have changed. It used to be a lot of low back. Now we have a lot of neck. We have a lot of, upper back, shoulder, trapezius. This kind of region where there's a lot of stress that builds up. Mental stress as well can cause
Right.
that to trigger. So I think, yes, there has been a little shift. But I'm happy to say that from my experience in Goa, that most of the people are very active. We do lead a decently active lifestyle. Of course, we have the beaches, and we have enthusiastic cyclists. We have gym goers. There are so many things
Actually,
that are
Brian, you're
going
so
on.
right, because the other day I was at Miramar Beach and I just realized that the number of people who are not just walking, they're actually literally running. And I've seen people even in their 50s and 60s actually running on the beach. And it was very heartening, and it was a push for me as well. Okay, I need to start sometime, which I'm going to do one of these days. Not yet started, but yes, getting down to it. You have said that some of the problems you mentioned, that it's because of some mental stress, and you said at the back of the neck, the nape, they complain about pain out there. Now, how do you treat something like that? Because you said it's mental. So what is your role in a
Um,
situation like this?
so of course, it's not always mental. The mental stress can start affecting it only because of the fact that you maybe are working more than 8 hours. You have targets, all the normal
Yes.
stuff that
Right.
corporate people have. And especially from working from home, there's no kind of release. Sometimes you can just switch off when you're driving home or when you're traveling by public transport. But here you go from your table to your dinner table and then to your bed. So there's a lot of built up stress. And you said in your opening statements about movement, and there's nothing better than movement, not only at the end of your day, but through your day. Just sitting at the computer, taking a break, just moving your body, twisting a little bit, turning your head side to side, up and down, getting those, raising your arms just to kind of alleviate the tension in the neck. I think there are lots of ways that you can manage stress, manage aches and pains, and
Right.
not allow the body to go into a repetitive cycle of pain and tightness, stiffness, and then eventually break down and having to, go get it seen to.
So, besides the backache, which is I think the most common, the backache, the lower back, the upper back, and the neck. Besides these three, which are the other common problems, and which have you seen that have become common in the last few years?
Um, I think, you typically have the back, which is because it's the core of the body. You have a lot of people coming with those complaints. Those are more chronic injuries. If you want to ask a question like you did, it's more the acute injuries that you might be concerned about or you might be asking about. Now, I think that depends on lifestyle a lot. It depends on what activity you're doing that might bring on an injury. For example, if you are a badminton player, if you play badminton every evening, at the end of a work day, and if you try to keep yourself fit by playing badminton, you are likely to have shoulder related issues.
Okay.
If you are a housewife and you have a festival coming up and you are then working a lot around the house, doing a lot of cleaning up, maybe cooking some sweets, you tend to have a repetitive strain injury on the forearm. So you could have onset of a tennis elbow. If you are someone playing sports for fun on the weekend, or you have let's play a Sunday football or something like that, you might just stretch to get the ball and have a hamstring injury. So those are kind of the more acute injuries that one might see. I wouldn't say that there's any one in particular that I've seen more frequently, but the core of the body, so the head, neck, the shoulder, head, neck, and rather the neck, mid back, and lower back are what we normally see very regularly as a chronic, regular pain. Also, we have joint pains. I think to answer your question more pointedly, I think the knee is something that has been troubling people recently a lot more. But
But
that's
doesn't that,
also
Brian, doesn't that come with age? Isn't it age related?
exactly, exactly. So a lot of people, I mean, there's an option now of replacing the knee, which might not have been there a while ago. So everyone's more aware of that. I remember in Mumbai, it was kind of a fashion. You ask the person, haven't you got your knees changed yet? It was more of that sort of culture in Mumbai. But in Goa, it's still people are still a little bit, I would say, cautious, or they are not so open to surgeries. I think the orthopedic surgeons also in Goa are very prudent when it comes to operating the knee. No one wants to jump in on it immediately. They, try to give solutions, or sometimes in joint injections, and they try to delay as much as possible the replacement of a knee. Um, but I would say, because of the awareness of the fact that yes, there are options to manage knee pain and to take care of knee pain, people are presenting with even the slightest knee pain. So they will say that, okay, my knees have started to give way. For example, if some person, at the age of 50 decides, let's start running a marathon. Yes, after a year or two at the most, he's going to start having knee pain because your body's on the decline after a certain age. And if you then pick up a sport that hammers your knee, for sure your the wear and tear within the knee is going to be more. But I think people are more so coming up with aches and pains in the knee because they believe that there are solutions out there which they can use that so that they don't experience pain. So the knee pain is something that is on the rise, I would say.
Also, another condition, I know about 3 to 4 people who have the same condition, and that is sciatica. Now, what exactly happens in sciatica? How can it be avoided? And if you have it, what can be done to improve your condition?
Right. So sciatica, I would say yes. It comes in nicely with your line of questioning for the last 10 minutes. Sedentary lifestyle, things that are bothering you more recently, and with more people having it. But sciatica, I would like to split sciatica into two causes of sciatica. One would be coming from the nerve root, that is the lower back or the spine. That could be due to spondylosis or a past history of a slip disc, where there is actually pressure on the root of the nerve, causing pain coming down the nerve at the back of the leg. Sometimes the pain can go up to your buttock, sometimes it can go lower to the back of the knee, and sometimes
Right.
it can go right up to the ankle and foot. Now, people
And it is
present
very,
with
Brian,
acute.
it is very painful, isn't it?
It is painful. I think more than being painful, it's unrelenting. You cannot find a position that eases it.
That
So
eases
I
it,
think
yeah.
that's what frustrates people the most, because whatever they try to do, however they try to move it,
Yes.
it kind of
Yes.
keeps niggling, tingling, numbness. Sometimes could be a burning sensation. But like I said, there could be two causes. Now, if you have a cause coming from the spine, typically you would find it difficult to bend over. So if you bend down to touch your toes, that would increase the loading on the sciatic nerve, and that would cause a little more pressure and a little more symptoms coming through the nerve. They call it a slump test. But the other one that I find more frequent and more common among patient groups are what is called a piriformis syndrome. There is a muscle in the buttock called the piriformis, through which the sciatic nerve passes. Now,
Okay.
this muscle typically gets tight and presses on the nerve. So, classical sign is you will be able to bend over, no problem. You will be able to rotate, so the spine won't show any symptoms. But if you press the top of your buttock, the top of your glute, or even in the center of the gluteal muscle on one particular side, you'll find an increased tightness and pain. Now,
So are you talking
if you're
about the
able,
end of the tailbone, Brian? Is that the area you're speaking about?
it's not the end of the tailbone. It's end of the tailbone and one
At
side
the
or the
side.
other.
Okay.
Yes, one side or the other. If you have a
On either
sciatic
side.
symptom,
Okay.
well, it'll be one side or the other. Typically, you have sciatic symptoms on one side. So if you do, then say if you have pain coming down the right leg. So on the right of the buttock, on the right of the tailbone, you'll feel a little kind of spot where if you dig in, you feel a lot of pain. You might feel relief if you keep it dug in for a while.
Right.
But there are also some stretches that you can do, and a little bit of care on that particular muscle will allow it to reduce in tightness, reduce in inflammation, and thus reduce pressure on the nerve.
Okay.
So I think that's one, you have to identify what the source of the pain is. And if you treat the source, if you're able to manage that muscle, loading that muscle or stretching that muscle and easing the pressure of the nerve from that level, you're definitely going to improve your symptoms, and it'll stop hurting immediately.
Right. So what about, how can we avoid? What is it that we are doing that causes this problem? Is there anything we can do to avoid it?
So there's nothing really that we can do to avoid it. Typically, I would say that sitting for too long definitely puts pressure on the glute. It definitely puts pressure on that muscle. It's like you're sitting on the nerve through the day. So getting up and moving ever so often, having breaks in your workday, going for a walk in your lunch break, things
Okay.
like that, where you don't stress on the nerve for too
For
long
too
at a
long.
particular time, will definitely reduce your likelihood of getting sciatic
Right.
symptoms.
Right.
On the other side, if you do have sciatic symptoms, especially if it comes from the piriformis, then we can work with stretching. We can work with a little bit of muscle release on the piriformis to reduce pressure on the nerve. We can also work with a little bit of core strengthening and a little bit of groin strengthening to offload the muscle on the buttock. So that would require, there's no one size fits all. You would have to get it assessed and figure out what the source of the pain is. If the source of the pain is from the lower back, then it would be treated a bit differently, maybe with
Okay.
rest. And we could, it would take a bit longer because the source is from a pressure, from the nerve root level. But this is more from the muscle pressing on the nerve, so we have more control, or we can control the muscle a little bit better
Right.
than the spine and than the disc.
Okay. Fine. It's time for a short break. Don't go anywhere. We'll be back real quick. Welcome back. This is the Navin Times Talk from the Heart. We are in conversation with Brian DeCosta, physiotherapist, and Brian has been telling us about various conditions and some tips on how we can handle them. Brian, we last spoke about sciatica. Now, what about post-surgery rehabilitation? What exactly does that include? Suppose I've had, for example, I've had maybe a knee surgery. If I've had a knee surgery, as a physiotherapist, when you come in, what exactly is your role? What are you going to be helping me with?
So, well, primarily it depends on what surgery you've had.
Right.
There are minor surgeries and there are major surgeries. So, if you'd like to take an arthroscopy as a minor surgery and a knee replacement as a major surgery,
Right.
the timelines of rehabilitation are quite different. So, in a minor surgery, we are looking at 3 to 6 weeks, and a major surgery like a knee replacement, we are looking at maybe 1 to 3 months for you to get fully functionally independent, for you to have no residual pain, for you to be able to achieve functional independence, because that's the goal of physiotherapy, is to allow you to achieve functional independence. This is basically what we are looking at with regards to timelines. But what my primary handling of the knee would include basically first trying to get strength control back, trying to get range back, and then eventually trying to get function back. So when you do have, we'll go with any one just for the sake of simplicity.
Yes. Yes.
So if we have an arthroscopic surgery, typically you are able to bend the knee to a certain degree after the surgery. Sometimes you are out on the same day. Sometimes you're out of the hospital the day after. You are also able to load the leg, but you are not able to maybe fully bend the knee. Once something goes into the knee, the muscles go into reverse inhibition. They stop working. They kind of shrink overnight. So we then have to start building control of the muscle, retrain the muscle in its full activity, and slowly get you back to 100% of function. Now, 100% function for different people is different. Some people want to go back to driving. Some people have a more physical job, so they have to stand long hours. Some people are just sitting at a desk. So especially if you do a kind of a surgery like an anterior cruciate ligament surgery, which is one of the major surgeries in the knee done through arthroscopy, your rehabilitation time, if you want to go back to sport, can be, it varies, but I would say 6 to 9 months. Wow. Whereas if you want to go after your knee replacement surgery, your arthroscopic ACL surgery, if you want to go back to your desk job, you could be there in 6 weeks at the most. Once your knee bends to 90 degrees in about 3 weeks, you could probably go to the office as well. Right. So it varies for different people. The goals and what we want to achieve also varies depending on the surgery and also depending on the surgeon. So I make it very clear to the patient, I need to speak to your surgeon because he has gone in, he has done what he's done. either I speak to him or I have a thorough read of your discharge card to understand what surgery has been done, and that will also dictate timelines. It will dictate how we approach the patient, what the goals will be, how much bending we expect, and how much, what the time frame for rehabilitation will be.
Right. Now, physiotherapy, like, other areas of medicine have advanced in the same way physiotherapy, I'm sure, has advanced. So, what are some of the new treatments? And what is the scope of those treatments? How are they going to be helping, or how do they already help patients? Can you tell us a little bit about
So
that?
I think, yeah, I think physiotherapy is basically using physical modalities as a therapy. Now, physical modalities or physical um, management, such as exercise, all contribute towards, under the umbrella of physiotherapy. Now,
Right.
recently we've had, different techniques that have been adopted from the East, the West. We have physiotherapists doing dry needling. This is a Western concept picked up from acupuncture, which is an Eastern concept adapted. And it's been growing in the West. Cupping is a therapy that I think first made its mark in 2012 Olympics, when Michael Phelps had his back full of round circles, and everyone was, what's all that about? And recently, a lot of top athletes promote it as well. But there are physios, especially in Goa now. We have had a lot of physios get trained in dry needling and cupping that have been organized. Some of the senior physios have organized courses and organized lecturers and people to come in and give talks and workshops on these different modalities and new tools. So that's good. That's great. I think everyone needs to start somewhere, and then from there, with practice and with sharpening your skills, you keep getting better at it. Now, I don't want to dismiss any form of treatment. I wouldn't want to dismiss needling or cupping or muscle release or exercise therapy, because I think everyone has used this at some stage, because they have been useful and they have given results. So a lot of people say now, oh, stop using machines. There's no evidence against for machines. But 25 years ago, you were only using machines, or 20 years ago, ultrasound was the best thing that there was. So of course, at some stage, it did work, and I think everything that grows, or um, every technique or every technology that comes out is helpful, and that's why it has been successful. No one is going to just use it if there's no result. So it's just about using all the tools that you have, integrating it with what the goals of the patient are, integrating it with what you feel comfortable doing. For example, I don't do cupping. So a lot of patients used to come to me and say, I want cupping. I say, no, I don't do cupping. If you want cupping, you can go somewhere else. But it's just about, individual. If the person comes in telling you what treatment they want, then maybe, they are not going to get okay with what you want to offer them. So, knowledge awareness, but also from a physiotherapy standpoint, getting all your tools together, figuring out what works best for you, what you believe in, what you think has helped improve your patient down the line in the past, learning from your experiences with what might not have helped your patient, and then building a rehab plan for the patient that's coming to you. So
Right.
there are lots of tools, there are lots of sciences, there are lots of techniques and technology, but I think each physiotherapist needs to choose what works for them.
Talking about new methods of healing, like you rightly said, Brian, like you rightly said, each one as a practitioner decides what is working best for him. He or she knows what works with his or her patients, so it is up to them to decide. But a new practice that I don't really know how old or new it is, but we have heard a lot of kinesiology. Can you tell us a little more about it? And have you used it? Does it help? What exactly is it?
So, my understanding of kinesiology is movement. Basically, in one word, is movement. The science of movement, the study of movement, the improvement of movement, the ability to get you to move to a point where you're functionally independent, and also to kind of use physics, chemistry, um, use biomechanics to kind of train function and try to improve function. Now, kinesiology is the science and the study of movement. That's my understanding of kinesiology. And I think as physiotherapists, it's quite close to what we do. There are lots of little branches of that break out. Some people focus on manipulation, and they call it, chiropractic. Or some people focus more on manipulation of other organs or soft tissue. They call it osteopathy. And there are courses for that. So you can become a certified chiropractor or an osteopath. But I think they all come under one big umbrella of physiotherapy. I might
All
get
right.
beaten for this, but this is what I believe. I think we all do a little bit. If you ask me to, click your SI joint, for example, I will be able to do that under my physiotherapy practice. To manipulate the joint in the lower back. So this is what chiropractic does, you see. So there are a lot of overlaps and overlays. I think, like I said, when it comes to rehabilitation, we first want to bring back the movement,
Right.
because if the patient doesn't have range of motion, it doesn't matter how strong your muscle is, you will not have the function. So I think kinesiology is a very specific science. It's a very I would say very pointed science, which deals only with maybe the biomechanics of movement. It will definitely help. I mean, like I said, there's no science that doesn't help. All the science have come about in order to, help you, and in order to strengthen your tools or your ability to recover somebody. So that's, kinesiology is, like I said, study of movement. That's what it is to me.
Okay, because I've seen some pictures of it, and it's like some tape, some big bandages that are there on people who are doing kinesiology.
Oh, so okay, so I think you're talking about kinesio taping.
Okay,
So
that's
kinesiology,
different.
yes, that
Okay,
that is totally different. So
okay, taping.
kinesio taping is big in sports physiotherapy. Okay,
Okay.
so that's, I mean, that
Do
is
you
what
use it
also,
on your
comes about.
patients? Do you use it
Yes,
on your
definitely.
patients? Okay.
Yes,
Can you
yes,
tell
I
us
do.
something about
That
that?
is, yes. So that is I would say within within the scope of physiotherapy. It's called kinesio tape because it's basically elastic tape that kind of stick on the skin and kind of promote movement or promote direction of movement that you want to get from your patient. So I would say I use it a lot in athletes. I also use it when I want to activate a muscle for some patient, or when I would like to protect a muscle, uh, and also when I would like to reduce inflammation. So it works excellent if you use it on the ankle and the foot, if you use it around the knee to reduce inflammation. I recently used it on someone to reduce pressure in the knee from osteoarthritic changes. So and had success with it. So yes, kinesio taping is very big. It works. What we try to do with kinesio tape is we try to offload, but we don't just offload and leave it there. We try to strengthen the other groups of muscles that can then take over function. Otherwise, we would be taping you for like 6 months. So taping is just to kind of offload or to rehabilitate for that period of time. You do see athletes wearing it very often, but that is maybe if they are carrying an injury, maybe if they're trying to protect a structure while they are playing, uh, and that's what it's used for.
Earlier you said that you do not utilize cupping, right? So dry needling, is that what do you use dry needling then?
Yes, I do use dry needling. I learned dry needling, from peers. There's no there's no formal course that teaches you dry
So
needling.
what
Now
exactly
there
does
are.
this involve? What does it involve?
So dry needling is basically putting a needle into your, into the bulk of a muscle that has gone into spasm. So it could be what is called a trigger point. So you have sometimes, if you press, even now, if you press along your trapezius muscle, you might find one point that is a little bit tighter. So that's where the muscle, the nerve and muscle kind of integrate. Um, and dry needling typically is used when you want to help recover a muscle, when you have what is called a twitch response. So you put the needle in, you get a twitch response, and the muscle relaxes. So I would argue that it helps. Definitely, it helps. I've used it a lot on athletes and footballers. At the time, I remember when I was with Mumbai City FC, we had one of the senior physios who was doing it, and I learned my craft there. Now, at the time, there was no formal dry needling program. They call it medical acupuncture in the UK. But at that time, and even now, it's basically, if I set up a company tomorrow and start a dry needling course, it would be a certificate. You see, so at the moment it's like that. But it is something that has been useful, that has helped people, that has helped therapists, and has got very quick results from very, very quick results.
So
I mean, I've had
basically,
athletes who would.
it is an Eastern, traditional practice that has been now incorporated into physiotherapy. Wouldn't you say?
So if you look at what the Eastern practice is, the Eastern practice is acupuncture. Now,
It is.
acupuncture typically goes by the meridians of the body. It's not really putting the needle into the muscle that is affected. You could have an ankle. I don't know much about where the points are, but you can have an ankle problem or a calf muscle problem, and they might put a needle in your neck or in your shoulder.
Okay.
So to treat that, so it works on the meridians or the imaginary lines of the body, and that's Eastern science. But the West has adapted that. They've realized that a needle can help if you poke it straight into the muscle at the point of tightness, at the point of the trigger. And
Right.
if you get a twitch response, so it's a different science, but it uses the needle. The needle is common, but the science
Yes.
is totally different.
Yes. Okay. Now, another thing that, especially during the pandemic, I've read that there are a lot of people who are sitting at home. I was one of them, and working from home, and a lot of tips were given of using the gym ball or the Swiss ball. That use it and sit on it, and your back problem, neck problem will gradually decrease. How does this help? How does this work?
So the idea of the gym ball or sitting on the gym ball is to continuously challenge your core muscles. Now you want to sit on a ball that is unstable. So your
Right.
abdomen is working throughout. When your abdomen works throughout, you are always in a state of exercise actually, and you're using that to control and to keep altering the loading pattern on the core and the lower back. But I would argue that you don't always need a gym ball. You can keep changing posture even while sitting at your chair, on your chair. For example, if you slide to the front of your chair at the moment and drop your knees down below the level of your hips, what you'll realize is that it becomes difficult to slouch in that position because your pelvis tilts forward.
Okay.
So just adjusting yourself on your chair, throwing a pillow at your lower back for half an hour of the day, sitting right back into the chair for some time, doing a little bit of hamstring stretching that can help ease the pressure of the back. So there are many ways. The gym ball was I would say it was a fad. It was something, like
Okay.
let's sit on a ball. I mean, many workplaces have also now have gym balls. It is useful, especially when you get very engrossed in what you're doing and you forget to do all these other things on the side. The gym ball might be a good solution. I
But
wouldn't
if
I
you
wouldn't not
remember,
recommend it.
but basically, what you're saying is, if you remember to move as often as possible, and make sure that there is movement on all parts of your body, then the Swiss ball may not be required, right?
Yes. I would say that the gym ball is just another tool. You can have they also have rocking seats now, so you can sit and that seat keeps rocking back and forth. So it's basically to keep activating the core, make sure that your back is not just sitting there and your vertebrae sitting one on top of the other and your neck
Right.
protruding forward. So it's just to keep you continuously moving a little, so you don't have these injuries that come because of being sedentary.
You just now spoke about stretching. You said it's so important. There is a lot of importance given to stretching, especially when you are an athlete, when you start gymming. They say stretch before and and stretch after. How does stretching help?
So this is a very, very gray area. Lots of people disagree. There are experts who say one thing and the experts who say the other thing. There is evidence given for both. Um, but I think when it comes to stretching, it depends on what activity you're stretching for. Are you stretching just to to improve mobility? If you're doing yoga kind of stretching that you do in the morning, is it a sustained stretch? Do you do it for relaxation? Do you do it for maintenance of joint length? Do you do it for maintenance of muscle length? Or are you a footballer or an athlete who needs to have, short bursts of muscle contraction? So are you doing it to improve the short contractions at your muscle and tendon? So I think it keeps varying. Also, the way you stretch changes. So do you want to do a sustained stretch? Do you want to do a quick stretch? Do you want to do a stretch, which you slowly keep increasing the range? And how, or do you want to just do a quick warm up, a quick stretch before, just activate muscles before you go into a sport? Now, contrarily, there is evidence, very strong evidence to suggest that runners or marathon runners who regularly stretch have 33% higher chances of injury than those who don't stretch. Now, this could tie
I'm
into the
very
fact
confused
that
now.
when you
Brian, I'm really confused.
exactly. So exactly, and that's why I said it's such a gray area, and there's continuous research coming out. But everyone gives their reasoning, and you can understand why they say that, or why they've actually proved that, or what they've basically done. They've done statistical analysis and understood that runners who stretch have a bit of more mobility in the joint. But when you are a runner, you want more stability in the joint. So then you want to focus more on core stability, on balance training, and you want to build stability in the joint rather than mobility in the joint, because you're doing one movement. You see, you're just running in a straight line.
Right.
So you don't want the joints to keep flapping around. Whereas if you're a footballer, you want that mobility in the joint. And you want fast twitch reactions. So you want your tendon to be able to load quickly and unload quickly. And you want that to all happen, within the capacity of your body. Otherwise, you can have tendon injuries or you can have strains. So
So it
stretching is
depends.
very
So
gray
what you're
area.
saying, Brian, it basically is that it depends on the objective of your stretching. Why exactly are you stretching? So depending on
Yes,
that,
like
then the stretching, the time and the extent of the stretching changes. Am I right?
yes,
Okay.
absolutely.
Now, like you rightly said, that more and more people in Goa, especially in Goa, that we have seen, they become very health conscious. I know friends of mine who are in their 40s and 50s who have taken to running marathons. They are so enthusiastic, and looking at them, I am enthusiastic. So it is so infectious. This enthusiasm is so good. It's so infectious, and it's very encouraging to see someone who is sometimes older than you and running well. However, it's not always smooth sailing. When you start, you've never really been into sport or exercise, and when you start running a marathon or want to start running a marathon, you have to start training. Some people think it's just a month or two of training is fine. I don't know if it is. But what are some of the mistakes that beginner marathon runners make? which should be avoided at all costs?
Um, well, well, first and foremost, I think people take up marathon running more for for mental goals than physical goals. I
Absolutely.
don't believe that someone is going to go at the age of 45 and want to run a marathon. It's more like the challenge of doing it at that age,
Absolutely.
at that time in life. You probably always admired people doing it and wondered what it takes to do it. So it's such a big, it's such a mental game at that stage that you tend to overlook what your physical limitations are. Now, this can work for many people. It's worked for Anil Ambani. That's one of the businessmen I treated. He was able to run marathons for a number of years. He picked it up, very late in life. Um, and then the 1 year that he didn't run the marathon is when we told him he couldn't because his knees just gave up.
All right.
But the next year he was running again. So it's such a mind over matter thing when it comes to marathons. I don't believe that anyone might will not run a marathon or can run a marathon. But if you ask me about the mistakes, I believe that no one is going to just get up one day and start running uh, and start running a lot. Everyone's going to keep growing, the distances that they run. There are lots of apps. There are lots of okay, forget apps. There are lots of coaches in Goa and lots of groups in Goa that do marathon running as groups. Uh, you know, uh, there's so much that you can learn from your peers. And why I say this is because if you try to go to a physiotherapist or you try to go to a doctor and ask them, what marathon running entails, for those who haven't done it, no one knows. I don't run. I don't like to run. So I find if someone's running for 3 hours and I'm asking them always my question to them, even for people who swim, I'm like, what are you thinking for those 3 hours? Like, how can you be alone with yourself for 3 hours doing one movement? So,
Right.
it's like I said, it's an entire mental game. Uh, I would say that the best way to do it is to go through coaches who have experience, through coaches that who have taken other people through the same path because they are very motivational. There are coaches who, like I said, I've had patients at 60 take up triathletics, and so the coach is your number one, at that time. And with their experience, they are able to assess from your reaction, from your mood on a particular day, from your, the chats they have with you about how has your week been. They will be able to, schedule a plan for you. So I would say don't take it up with a doctor or physio. That would be my recommendation. If you want to talk about injury prevention, injury prevention, if you're going to take up a sport like that, or you're going to take up a challenge like that at that age, you are, I would say, bound to have an injury. I think most of the people will have some injury or the other. But again, it's mind over matter, how fast you deal with that injury, how fast your body, recovers, and, the expertise you get. And also, it's also about learning your own body. So sometimes you might feel that, okay, yesterday I pushed myself. I felt very sore that day. So the next week I'm going to run 1 kilometer less, and I think I'll be
Right.
okay. So it's also about learning your body to be able to keep yourself away from injury. And the coaches are very experienced when it comes to planning progression, planning when to offload, planning what to do with regards to strength, or how to build strength alongside, how to build core stability. So there are some good programs out there, especially because I've worked a lot in Panjim. Panjim has some good support. If you look around, you'll be able to find the right people.
You said that you don't like running. What is the sport? Is it just football? Do you just play football?
No, I like working out. I like the gym.
Gymming.
Yeah, I like gymming. I mean, exercise for me is not. um I would say I don't like to say that I exercise every day. I don't, but it's about maintenance. If I feel that my body is going, I always go and take control of it back. That's something, and I don't know if I should believe it or not, but there's this thing called muscle memory. I haven't done much research on it, but it says that when you go back to doing activities that your body is used to or has done in the past, your body immediately, takes shape, goes back to it very quickly. So for a person who has maybe like me been to the gym in bits over time, lifting weight or trying to strengthen muscle, I do find it very easy. So I was a shot putter when I was younger. So my shoulder exercises are always very easy to go back to compared to maybe other body parts. So I think if you have history of being an athlete, I think exercise is always going to be part of your lifestyle. You're not going to be averse to doing exercise. And exercise doesn't mean always a very organized thing. Even just going out for a walk it could be considered an exercise. Now, why I say
Could
that
be
is
considered,
because
Brian, may I
yes,
correct you? When you say could be considered, for me, I think it is a fantastic exercise. And you are so
yes,
right when you said that there is muscle memory. Like, for example, I walk as often as possible, and I do brisk walking for about 7 months. Due to some reason or the other, I wasn't able to. And when I did get back, I thought I would fall flat on my face because I walk really fast. At the speed I walk, I thought I would fall flat on my face. I was surprised when I didn't. So you're right,
yeah,
the muscle memory is there. And so you're gymming and I am brisk walking. Exercise,
absolutely.
exercise,
I
exercise.
exercise is exercise. I don't. Why I say that? Why I say that? Even if you walk, because you also said that you are not really a gym person or you haven't run marathons before. So for you, even that is good enough. That your baseline is a bit lower. So even doing that will make a lot of changes in your
It
daily
is.
life, in your mental health and everything
It
associated
does.
with it. So for people who are exercising a lot, for example, a marathon runner, when he's injured, he's an absolute wreck. He can walk 10 miles. He doesn't have the same mental peace because he can't run the
The
10 miles.
satisfaction is
You
not
see?
there.
So the satisfaction, even the body doesn't feel good. So you
Right.
have a lot of my patients who are fitness freaks. They go on vacation, right? And on vacation they are running in parks, they're gymming, they're going outdoors doing push-ups because
Right.
because their body is at a different level of training and a different level of exercise. So when they don't do it, they feel horrible.
Brian, just time for one more question, and that would be if you were to recommend one exercise for overall flexibility, for overall ease of movement for people of all ages, what would that exercise be?
So when you say ease of movement, that's movement based. If you say flexibility, that's stretching based. If
Okay.
you say cardiac health, that is basically if you go for a walk or if you go for a jog.
So
And
can we
then
put
if
it all
you
together? Is it possible?
yeah, I don't believe it's possible. I don't believe
Okay.
it's possible. There's no one exercise, because even for example, I mean, people say Surya Namaskar is the ultimate and it incorporates everything. It does incorporate stretching. I would say it's one of those up there, but not many people can go and put load on their shoulder, for example. People who maybe have a shoulder injury, people who are heavier, they can't go into a push-up position to hold that. They can't do a downward dog because of low back pain. So it's something that is good for a fit person, or you need a certain level of fitness to be able to even do one Surya Namaskar. I'm sure you can build up towards it. But for
Right.
those people, I would say, you can break it up into movement. So movement as in simple neck movements, because we don't tend to do that in our daily life. We are sitting
Right.
head straight, we are driving head straight. At the most, we have to look in the rear view mirror, one side and the other. So we don't really look behind, we don't twist our body. So just taking your body through all its movements will help with mobility. Getting a little bit of stretching done, especially in the posterior shoulder to reduce pressure in the neck, getting your hamstring stretched to reduce load on the lower back. A little bit of stretching through the day,
Right.
and of course, the most basic human activity is walking. I think humans were made to walk and sleep. I think we invented sitting, but standing, walking, and I think that's going to be the exercise that I would recommend. Also, very very helpful in diabetic individuals. So things, just the basic exercise like walking is going to have a very low impact on the knees and the other joints. It's not going to degrade the joints as much as some other strenuous or high impact activities. So it's I would argue that it's a safe exercise. It's something that you can do in any setting. You can do it, walk on the beach or walk on the pavements or walk in the gym. Wherever you are, you can walk. Walk around your building in your complex, for example, or walk down the village roads, whichever one suits you.
The village roads are becoming very crowded and it's not possible to walk anymore on those roads because it's stressful. You don't know what is going to bang into whom you are going to be banging into. So yeah, but thank you, Brian. It has been so informative, the talk. We've learned so much. Thank you. And to all our viewers, thank you for watching, for your time and for your patience. I hope you've learned as much as I have. Until next time, a goodbye from all of us here at Go 365 and the Navin Times. Brian, thanks again.
Thank you very much.
All right. Bye.